Hi, this is the abdominal exam. I'm Alicia, I'll be your provider today. This is Allison, she's my daughter. Do you give consent for us to do the video?
Yes.
For United States University for my instructor to watch. So I'm going to go ahead and have her lay back on the table and make sure that her feet are present. Normally with a patient we would want to have them in a gown so we could pull up their shirt, but she's in a swimsuit today for the camera purposes. So first you're going to start with the inspection of the abdomen. You're looking for any movement of peristalsis, you're looking for the contour, noticing the shape, noticing for any obvious protrusions, any obvious hernias that you can see on from the outside. Then we're moving. We're also looking then at the skin color, making sure they don't have any jaundice, which we may see, as the patient presents, but you would definitely see that also in their abdomen. Then we're going to move on to auscultation of the abdomen. We're going to listen in all 4 quads with our stethoscope, listening in the right upper quadrant. We're listening for vowel sounds. We're listening in the left lower quadrant. And on the left side as well. We're also going to listen to the aorta. We're going to auscultate and with our bell. We're listening for any bruits or thrills. We can move on over to the renal arteries. The iliacs and the femorals. And we're doing that bilaterally each time. Then we're going to move on to percussion of the abdomen. When we're percussing, we should hear tympanic sound or feel tympanic as the abdomen has air. We're listening for dullness if we're over. When we're looking for the liver border, we can percuss up. When we feel that or hear that dullness, we can mark that. And then going in between the ribs, we're going to percuss. Listening for that dullness and then measure. And we should have like a 4 to 7 centimeter liver span. When we're percussing, we're listening for any dullness also over the splenic area. And it's not unusual to not be able to palpate or percuss the spleen unless it's enlarged. And that would kind of lead you to suspicion of something going on there. We also want to percuss. We can also percuss for the bladder, and you'll feel it or hear a dullness there also when you're over the bladder. And I can hear a difference in those tones there. Then we want to move on to palpation. We always start off with light palpation of the abdomen because we don't want to, number one, we want to get them used to us touching them, and if there's any uncomfortableness, we know not to do deep palpation in that area. So first we do light palpation in all of the quadrants, letting the patient know if they feel anything uncomfortable, that they should let us know. And then we can move on to deep palpation. In this, we're feeling for any abnormalities. We can feel any tumors. Obviously, we're looking for any discomfort that the patient may feel. We're doing that in all 4 quads. We can also try to palpate the spleen with deep palpation. And like I said before, it's not unusual to not be able to palpate the spleen. We can also palpate the liver border. What we're looking for is the ribs. Sorry, am I tickling you? And you can kind of do a hook of that. So you're deeply palpating, you have the patient inspire, and then you can feel that hook underneath there and feel the edge of that liver border. If you can feel the liver underneath there, you've got an enlarged liver, or if you obviously see it protruding, you would know that as well. There's also a couple things we can do to rule out certain things. There is the Robson sign. If we suspect an appendix, an appy, we're going to go from the iliac crest to the umbilicus, and about a third of the way there is where your appendix would be. So if we palpate on the left side and they're having increased tenderness on the right side, that would be a positive Robson sign that may alert us to do further testing for an appendectomy or a pot appy. We can also do check for rebound tenderness if we do deep palpation and then let off right away. If that causes pain, then they have that rebound tenderness when we come off, then that is also a sign of that. And that can be done on the left or the right side for that rebound tenderness. We also can palpate to see if there's any tenderness in the kidney area. If they're if they've got any complaints of back pain, we want to be checking to make sure that it's not in that kidney area that's tender when we palpate that. So you can go ahead and sit back up. That completes the abdominal exam. Thank you very much.
Thank you.